Hey guys, it's Tina Sheth here at Rebalance Physical Therapy, and today during one of our mentoring sessions with all of us therapists, Stephanie is going to talk to us about good form for running. So I thought I would video her talking to us about it because obviously that's going to be beneficial for you guys. So here we go.
So a lot of people ask us about what's good running form, and for different reasons. Some of our patients are asking because they're having incontinence when they run. Some people are asking because they have pain with running or they have chronic injuries. And there's a lot of theories out there as to what's good form with running. So what we were looking at is what's strategically some of good tips that we can give to people on things to look for when you're out running yourself. So one of the things is as your legs are coming forward and your foot strikes the ground, a lot of runners tend to overstride, and so they're way out here, and they're stepping with their leg far out in front of them. And what happens is, the big thing you want to remember with running is what's the alignment of your body. And just like posture is important if you're standing or you're sitting, it's important when you're moving dynamically. So your ribs and your pelvis should always kind of stay in pretty good alignment, one kind of stacked right over the other. So if somebody's out here and they're overstriding, they have a tendency to lean back a little bit more. And a lot of women postpartum have a big tendency to do this. So we kind of go through 9 months of pregnancy like this, and we get used to our hips being forward, and we have our baby, and we just kind of feel like things are going to go back to how they were beforehand. But then you hold babies like this, or you hold babies like this. And so what happens is your hips kind of have that tendency to want to stay forward. So you go out for your run, and your hips are a little bit forward, and you see a lot of women kind of doing a lot of this type of motion as opposed to this type of motion. The motion that you really want, if you're running, you want to move forward more. So if you can keep your ribs stacked over your pelvis and maybe not overstride so much, think about like what it would feel like if you leaned a little bit forward into kind of like the wind if you were running. You wouldn't run back like this, you would kind of run with a little bit of a lean forward. That naturally stacks things one above the other. So you're already set up a little bit better in your trunk. And then when you think about your stride, where's your foot hitting the ground? You kind of want it to hit maybe just a little bit in front of you or just underneath you with a little bend in your knee. So a lot of people tend to strike with a real straight leg, and that puts a lot of force in your knee, especially if they don't have really strong hips. Then what ends up happening is there's just a lot of force delivered in through the leg that's unnecessary. You can't absorb the shock as well. So if you're running and you've got a little bit of support underneath you and you're lined up pretty well, then what ends up happening is your back leg that's off the ground actually can work better at the hip and support you better. So these are just a couple like quick and easy tips, and you can always come in and we can look at your specific running form. Individually, obviously there's little nuances that are always important to every person.